You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about minimally invasive spine surgery. With us, we have an expert on the topic. He is the founder of Woodlands Spine Center in Texas. His name is Dr. Siddiqui. Dr. Siddiqui, welcome to the program.
Thank you for having me on the show.
Now, before we get into today's topic, tell me a little bit about your center.
The Woodlands Spine Center was created just to focus on spine care only. Previously, I was working with an orthopedic group doing all the shoulders, the hips, and knees, and I had to give all that up just because I wanted to be the best at what I do with treating spinal problems only.
So that's all you do?
That's correct.
Now, a lot of orthopedic surgeons, I guess, do a lot of different things, knees, shoulders, hips.
Yes.
So you just spine. Why spine for you?
Well, I've always identified with people that have spine problems. I've got a bad back myself. A lot of people I know have bad necks and bad backs. And,
did you have surgery?
Yes, I did actually.
Oh, really? Okay.
Yeah, it just so happened I just finished my training. I did my fellowship at Texas Back Institute, and I just started a new job and was keen to get going and herniated my L4-5 disc. And like a lot of people, I tried injections and tried therapy, and it just wasn't working out. So I ended up going back to the same place where I trained to have my surgery, and thankfully had a very good result.
What are some of the misconceptions about spine surgery or spine surgeons? You know, our show airs nationwide in Canada, and I've never interviewed a spine surgeon. I've talked to them and never interviewed. What are the misconceptions out there about spine surgery?
Well, I think
one of the lay to rest, I guess.
Yeah, I think one of the common misconceptions is that spine surgery is this great big ordeal that they're going to go through. They're going to be laid up for weeks and months. They're going to be in ICU, intensive care, and they're going to have horrible complications. It's really unfortunate because spine surgery has really changed a lot in the last few years, especially. And with some of the techniques we have both for diagnostics to accurately diagnose what their problem is and treat focal problems. And we can sometimes treat these focal problems with fairly less invasive techniques, so you don't have to be laid up for several weeks.
And people are flying from out of state.
Yes.
In certain cases to see you.
Correct.
Is this also true that you are getting a reputation, and maybe even, they're going to coin a phrase after you, same day lumbar fusion, same day?
Yes, we have been doing that.
Is that right?
Yes. We are able to use some techniques which we can go over a little later, where we can get these lumbar fusions done through smaller incisions, less tissue trauma, and because of that, the patient has less pain and they're able to walk immediately. And in a lot of cases, this can be done in the surgery center, and they're leaving 2-3 hours after surgery.
Okay. Now, and these people do have flexibility.
Yes, correct.
Because, fusion, we've talked briefly, but I guess some people consider it the F word. It's the worst thing that can happen, but people have movement.
Yes. In the cervical spine, you have 7 discs, and in the lumbar spine, you have 5. So there's lots of different levels. If you just fuse 1 or 2, it doesn't mean that you're going to be stiff.
So you're still...
You can still move.
Same thing with the neck?
Yes, the neck particularly so. You can move quite well after you have just 1 or 2 levels fused. Let's
begin, I guess, with, what are the different categories of spine care or procedures you do?
Sure. Well, the spine procedures can be divided up into simpler ones, which are just decompression procedures. And we're talking about discectomy, laminectomy. This is when we relieve pressure on a nerve or a series of nerves. And then moving along to some more larger operations, there's fusions where you stabilize a painful segment. And then now there's some newer procedures which are non-fusion technologies, such as artificial disc replacement, where you allow the spine to keep moving.
Is that right? And now that's been FDA approved for what? For the neck?
For the neck for at least several months now, and for the lower back since October of 2004.
Okay. Now insurance, I guess, there's FDA approval and then there's insurance approval. How does insurance look at this procedure?
Well, insurance companies, I can only speak for really Texas, but it's pretty much the same across the board. When the lumbar artificial disc was approved by the FDA in 2004.
That's a disc replacement?
That is a disc replacement. It's a metal and plastic replacement for the disc that allows motion instead of fusion. What we found is a lot of the insurance companies are calling it experimental, even though it's FDA approved, and we're not getting a lot of patients approved. However, when the cervical artificial disc came out, we found that insurance companies are
So a disc replacement for the neck?
Yes, it's actually done from the front.
Is that right?
Yeah, through a fairly small, for one level, the incision can be as little as 3.5 centimeters long.
I have questions about decompression. This procedure, it's been around for a long time. Is it proven? I mean, is it effective?
Yes.
And what is it?
Decompression is a procedure where there may be a nerve or a series of nerves that have pressure on them from various conditions, and we just go in and make more room. For example, in this model, you can see that there's a spinal canal here, and this is where all the nerves are.
Okay.
Now, what can happen over time, especially in an older person, is you can get some central stenosis, so the canal narrows down, the nerves don't have as much room, and we can go in.
So the nerves get pressure?
They get pressure.
From the narrowing?
From the narrowing, and what the patient typically finds is they get pain in their legs, and as they walk, they get more and more pain in their legs, and they have to stop and rest for a while, let the blood flow return to the nerves, because there's not enough room for the blood flow to the nerves.
And so that's a pinched nerve, what we're talking about?
Yes, that's spinal stenosis, and it's usually a series of nerves that are pinched. And so what we can do, and we can do this through fairly small incisions now, as opposed to in the old days when they used to do these 5-inch incisions. We can just be more specific and find the exact level where the pinching is. And just
so what do you do? What do you do there?
We go in and we basically do a procedure called laminectomy, where we remove the roof of the spinal canal and just allow those nerves to float back and have a little more room.
Just gives them more room. Interesting.
Gives them more room, and they can walk further, and hopefully their leg pain.
You do a lot of those?
Yeah, that's one of the more common procedures I do.
And that's called a?
Laminectomy.
Laminectomy.
Correct.
Okay, and what's the downtime on that?
They're looking at about a couple of weeks off, you know, from work or from their regular activities.
Can you walk around? How soon
you can walk around pretty much immediately. We restrict we limit the lifting to about 20 pounds or so for the first 2-3 weeks.
So you just remove that little bony area?
Correct.
And so it allows the nerve to
a fairly simple
concept.
This is not a new procedure. We're just doing it through smaller incisions now. And another example of a decompression procedure would be a discectomy, where you've got a herniated disc that's pressing on one particular nerve. For example, it may be on the right side at L4-5, and they may have pressure on that one particular nerve, and we can go in and just trim that disc through a fairly small incision, and about 95% of the time the result is pretty dramatic.
95% of the time?
Yes, their leg pain is better, if not immediately, within a few days.
Okay, now pain, as far as pain being a problem, how big of a problem, let's say in Texas,
I would
millions of people are suffering with pain?
I would say it's probably a lot more common than what the general public thinks. It's certainly the #1 reason people come to see me, because they have spinal pain.
Just the last two things you talked about. Would you say 50% of the pain population out there right now that has severe back pain could benefit from just something like that?
I would say the majority of people that have low back pain that have failed the non-operative treatments we talked about, which is physical therapy, injections, maybe chiropractic, and the treatments are either not effective anymore or they're less effective than they used to be, and they've got they're affected in their activities of daily living or things that they like enjoying. Taking long walks, jogging, playing tennis, playing golf, lifting up their...
So see a spine surgeon. I mean, is that your message? At least get a second opinion?
At least get an opinion.
Know your options?
It's not for sure that we're going to recommend surgery, but at least you know what are your treatment options. And also with some of the diagnostic tests, sometimes we pick up things where it's not just arthritis. You know?
Okay.
So it's important to get evaluated to make sure it's not something a little bit more sinister than just wear and tear.
Do you have stories where people, I mean, what some people would consider, you know, that were in pain for many years?
Sure.
And they failed these other treatments, just didn't work anymore, and then they get a simple procedure, or simple for you?
I mean, as an example, we had a 43-year-old male. He's a salesman, so he drives a lot. He sits for several hours in the plane, and sitting becomes a problem. Every 20-30 minutes he has to get up. Can't play golf anymore. He has a 3-year-old. Can't pick up the 3-year-old.
Okay.
And he's already had the injections and the physical therapy. It's not effective anymore. So we evaluated him. We told him he would be a candidate for just a 1-level fusion at L4-5, which was the bad disc. We were able to identify the pain generator as that level.
Okay.
And we were able to do his surgery minimally invasively through 3 small incisions. And it was done in the surgery center. It took about 3 hours. About 2 hours after the surgery, he was able to walk out of the surgery center.
Really? After back surgery?
That's correct.
Is that right?
Same day. And it's now about 6 months later. He's back at work. He's able to lift up his kid. He's back to playing golf.
What about pain? I mean, you know, on that pain level, I guess from 1 to 10.
Well, I think it's important to talk about that when we talk about successful results in spine surgery. If you've got a pain level of 8 out of 10 consistently, I think if we can get you to a 4, that's considered success. We can sometimes get you to 0, but we can't promise that.
Does that happen every once in a while where it's gone?
Sure. Sometimes you get a home run, but generally speaking, we like to get the pain to about half of what.
So the difference between 8 and 4 is
the difference between being on morphine, difference between having to spend half your time you know, having injections. Or being in physical
sleeping
therapy
and everything else is better.
Sleeping for a good 6 to 8 hours. That's a huge difference.